Hi everyone, my name is Mia Harris. I did my case presentation on fibromyalgia. Fibromyalgia is a chronic disorder that causes pain, stiffness, fatigue, and tenderness throughout the body, affecting the muscle, tendons, and joint tissue. Fibromyalgia pain can also be felt in the head, chest, back, leg, and abdomen. So this is the case study. Miss Jones is a 42-year-old female who lives alone in her apartment. She works as a cashier, where her job requires her to stand on her feet for long hours. She was recently diagnosed with depression, anxiety, and PTSD following a motor vehicle accident where she lost her fiancé and her 8 weeks fetus. She has been experiencing worsening body aches, poor sleep, fatigue, and tenderness in her joints, so she goes to the hospital. In the ED, in addition to the above symptoms, she also complains of depression, anxiety, insomnia, emotional stress, bloating, and constipation, which are indicative of irritable bowel syndrome that is caused by interstitial cystitis. She's also having sensitivity to temperature, which is like the changes in the weather, noises, and lights. She's also having difficulty concentrating and thinking clearly. Physical exams finding she was found to have decreased range of motion in her cervical spine, shoulders, joints, and lumbar spine. There was also joint stiffness and tenderness, as well as muscle pain, numbness and tingling in her arms and legs, body aches, and nerve pain. Diagnostic testing for fibromyalgia. The primary diagnostic test is the 18-point stimulation test, where pain and tenderness can be stimulated in the tendon and ligaments in the back, neck, shoulders, trunk, and limbs. So this here is a diagram of the 18 points where the pain and tenderness will be felt if it was stimulated to diagnose fibromyalgia. There's also the Fibromyalgia Impact Questionnaire, which is a 10-item scale that measures physical functioning, work, depression, anxiety, pain, stiffness, fatigue, and well-being. So, of course, Ms. Jones scores a 54 on this test. So the higher the number, that means you have fibromyalgia. Also, there's a fatigue severity test that measures the fatigue as well. It's a 9-questionnaire. It's a 9 items questionnaire with a score ranging from 1 to 7. And she scores a 45, so that's indicative of fatigue. And then the pain score is 9 out of 10. So based on all this, we can say that Ms. Jones is diagnosed with fibromyalgia because she scores 18 out of 18 on the point stimulation test. The exact etiology of fibromyalgia is not known, but there are many signs and symptoms associated with the disease. Depression and anxiety are associated with fibromyalgia, as the patient was diagnosed with depression and anxiety following the traumatic event where she lost her fiancé and her baby. She was also experiencing nerve pain, numbness and tingling, and fatigue and mental stress. This could be caused by an altered neural pathway that transmits and receives pain. Patient also had a decreased range of motion in her joints, or decreased range of motion due to joint tenderness and stiffness as well. So these are all symptoms of fibromyalgia. So based on all this, so the basic treatment for fibromyalgia includes Lyrica, which is used to treat nerve pain, as well as gabapentin, antidepressant. You can also use heat, massages, NSAIDs, occupational therapy, guided imagery, where you focus on a specific calming, peaceful location to get your minds off the pain, and relaxation techniques. So this is that. This is a very short presentation. There's not really much here on this topic. And these are my references. All right, thank you.